Singapore Nursing Board important question and answers. 1. In which of the following positions should the nurse place an infant following a pyloromyotomy? A. On the right side in a low Fowler's position at all times. B. In a prone position while sleeping. C. On the right side with the head elevated after feeding. D. On the left side in a semi-Fowler's position after feeding. Answer. C. On the right side with the head elevated after feeding. Rationale. Placing an infant on the right side with the head elevated after feeding facilitates gastric emptying and decreases the possibility of dumping syndrome following a pyloromyotomy. Prior to surgery, placing the infant on the left side with the head elevated reduces the risk of severe pyloric spasm. To reduce the risk of sudden infant death syndrome, the infant is placed supine for sleep. 2. A priority nursing diagnosis in the care of a child with pyloromyotomy is a. Trauma related to break in skin integrity. B. Fluid deficit related to loss of gastric secretions. C. Imbalanced nutrition, less than body requirements related to NPO status. D. Ineffective breathing related to tissue trauma from vomiting. Answer. B. Fluid deficit related to loss of gastric secretions. Rationale. The priority nursing diagnosis following a pyloromyotomy is fluid status, because the loss of gastric secretions can lead to more serious dysfunction of the respiratory and cardiac systems. Tissue trauma is important but is not a priority at this time. The child is not placed NPO without maintaining nutritional status by parenteral fluids until the child is able to take nutrition by mouth. Mucous membrane irritation secondary to vomiting usually does not lead to ineffective breathing. 3. Which of the following is the nurse's priority in the plan of care for a child admitted with pyloric stenosis? A. Assess the respiratory status. B. Maintain thermoregulation. C. Evaluate fluid status. D. Assess perfusion. Answer. C. Evaluate fluid status. Rationale. Fluid and electrolyte imbalance is a problem because of the loss of gastric secretions and poor nutrition secondary to projectile vomiting in pyloric stenosis. Respiratory status and perfusion may be affected by severe imbalance, making it a priority to evaluate fluid status. Thermoregulation is not an issue with pyloric stenosis. Altered perfusion is a result of altered fluid balance. 4. The nurse is preparing to delegate which of the following nursing tasks to a licensed practical nurse? A. Administer IV ondansetron to a client experiencing nausea from chemotherapy. B. Instruct a client on the adverse reactions of propantholine. C. Administer trimethobenzamide Z-tract to a client prior to chemotherapy. D. Develop a medication schedule for a client taking an antacid and several other drugs. Answer. C. Administer trimethobenzamide Z-tract to a client prior to chemotherapy. Rationale. A licensed practical nurse may administer a drug by Z-tract. Administering a drug IV, instructing a client on the adverse reactions of a drug, and developing a medication schedule for a client taking an antacid and several other drugs are nursing tasks reserved for a registered nurse. 5. The client was recently diagnosed with chronic hepatitis C. The nurse plans to instruct the client about which of the following drugs TA is used in combination with oral ribavirin. A. Lamivudine. B. Interferon alpha. C. Interferon gamma. D. Ganciclovir. Answer. B. Interferon alpha. Rationale. In clients with chronic hepatitis C, modest responses have occurred with combining ribavirin with interferon alpha. All interferons of the alpha class are used to treat hepatitis. Lamivudine is used only in the treatment of hepatitis B virus. Interferons of the gamma class are not utilized for hepatitis. Ganciclovir is utilized to treat herpes viruses. 6. The nurse has instructed the client about sulfasalazine, which was prescribed for her ulcerative colitis. The nurse evaluates which of the following statements by the client to indicate that the client understood the instructions. A. Nausea, vomiting, and abdominal pain are adverse reactions of Azulfidine. B. I should chew the tablets thoroughly and follow with a sip of water. C. I may notice that my urine turns blue. D. Azulfidine will decrease intestinal gas production. Answer. A. Nausea, vomiting, and abdominal pain are adverse reactions of Azulfidine. Rationale. Sulfasalazine is an anti-inflammatory agent and sulfonamide, which reduces gastrointestinal motility, inflammation, and microbial flora such as E. coli. Nausea, vomiting, and abdominal pain are adverse reactions. Decreasing gas formation is the action of simethicone. The tablets are not chewed, and Azulfidine should be administered with a full glass of water. The skin and urine may turn yellow-orange. 7. The nurse is collecting a nursing history from a client admitted on pancreatin. Which of the following diseases should the nurse question in the client's medical history? A. Hepatitis B, cirrhosis C, gallbladder cancer D, cystic fibrosis. Answer. D. Cystic fibrosis. Rationale. Pancreatin is a pancreatic enzyme used to replace enzyme deficiencies caused by disorders such as cystic fibrosis. Hepatitis and cirrhosis may cause vitamin and other hepatic deficiencies, but not pancreatic enzyme deficiencies. Enzyme replacement is generally not indicated for gallbladder cancer. 8. After administering ursodiol to the client with gallbladder disease, the nurse evaluates the priority outcome to be 8. Decreased vomiting. B. Increased comfort. C. Reduced stone formation. D. Decreased bile production. Answer. C. Reduced stone formation. Rationale. Gallstone dissolvers, such as ursodiol, are bile acids that reduce the cholesterol content in bile and allow for the dissolution of cholesterol-type gallstones. Decreased vomiting may result from a decrease in pain, which more likely will occur with analgesic use. Increased comfort will primarily occur with analgesic use and may be a secondary effect of stone dissolution. Ursodiol reduces the cholesterol content of bile, but hepatic production of bile is not affected. 9. The nurse selects the ideal antacid for a client because of which of the following characteristics? A. Sweet to taste, cathartic in nature, and effective for a prolonged period of time. B. Short-acting and readily absorbed. C. Not absorbed by the body and acts as a laxative. D. Decreases acidity without constipating or cathartic properties. Answer. D. Decreases acidity without constipating or cathartic properties. Rationale. The ideal antacid would decrease the acidity of the gastric secretions without either constipating or cathartic effects. 10. The nurse should question which of the following medication administration orders. A. Cimetidine 300 mg orally 4 times a day to an 86-year-old client with gastroesophageal reflux disease. B. Famotidine 20 mg and Maalox 30 ml orally at bedtime to a 23-year-old client with a peptic ulcer. C. Lansoprazole 15 mg orally daily to a 51-year-old client with a duodenal ulcer. D. Omeprazole 20 mg orally 3 times a day to a client with a pathological hypersecretion condition. Answer. At cimetidine 300 mg orally 4 times a day to an 86-year-old client with gastroesophageal reflux disease. Rationale. Cimetidine, a histamine 2 receptor blocking agent, should be avoided in the older adult because it causes confusion. 11. Which of the following is the priority for the nurse to include in the plan of care for a client receiving metoclopramide with chemotherapy in a clinic? A. Instruct the client to avoid driving home. B. Offer gum or hard candy for dry mouth. C. Administer to 1 hour before the chemotherapy treatment. D. Assess the client for extrapyramidal clinical manifestations. Answer. A. Instruct the client to avoid driving home. Rationale. Although it is appropriate to offer a client receiving metoclopramide gum or hard candy, administer the Reglan to 1 hour before the chemotherapy and assess the client for extrapyramidal clinical manifestations. The priority nursing intervention is to instruct the client to avoid driving home. 12. Which of the following is a priority for the nurse to include in the plan of care for a client taking ondansetron for chemotherapy? A. Monitor the client for fluid and electrolyte imbalance. B. Instruct the client to take the Zofran 30 minutes before the chemotherapy. C. Instruct the client to take an analgesic for the adverse reaction to a headache. D. Encourage the client to avoid activities that may cause drowsiness. Answer. A. Monitor the client for fluid and electrolyte imbalance. Rationale. Ondansetron is a serotonin receptor antagonist, which suppresses the vomiting reflex and chemotherapy-induced emesis. Because diarrhea is the most common adverse reaction of Zofran and the client may be experiencing vomiting from the chemotherapy, the client may become dehydrated. The client should be monitored for fluid and electrolyte imbalances. Although it is appropriate to tell the client to take the Zofran 30 minutes before the chemotherapy, to avoid activities that may cause drowsiness, and to take an analgesic if a headache occurs, they are not the priority interventions. 13. The nurse informs a student nurse that the loperamide prescribed for a client who is experiencing diarrhea has which of the following actions? A. Inhibits the peristaltic activity of intestinal muscles. B. Consolidates the stool in the intestine. C. Lowers the surface tension, allowing more water into stool. D. Distends the intestine by osmotic retention of fluid. Answer. A. Inhibits the peristaltic activity of intestinal muscles. Rationale. Loperamide directly inhibits peristaltic activity of the intestinal muscles, which results in decreased gastrointestinal motility. Consolidating stool in the intestine describes pectin, which is a component of the antidiarrheal cowpectate. Lowering the surface tension allows more water into the stool, which describes surfactant laxatives or stool softeners. Distending the intestine by osmotic retention of fluid describes the action of saline or osmotic laxatives. 14. The nurse should include which of the following in the medication instructions given to a client who is being started on antiemetics? A. Take the antiemetic within 1 hour after activity that promotes nausea. B. Stop taking the antiemetic when the activity that induces the nausea ceases. C. The urine may turn an orangish color. D. Avoid activities that require mental alertness. Answer. D. Avoid activities that require mental alertness. Rationale. A client taking an antiemetic should be instructed to avoid activities that require mental alertness because all antiemetics cause varying degrees of drowsiness that will affect the ability to perform a task. 15. The client is to begin taking methylcellulose daily. The nurse will include which of the following instructions in the teaching plan? A. Administer with at least 8 ounces of liquid. B. Administer at hour of sleep. C. Discontinue if no bowel movement in 5 days. D. Discontinue if taking Docuzit. Answer. A. Administer with at least 8 ounces of liquid. Rationale. Methylcellulose is a bulk laxative. Bulk laxatives must be given with at least 8 ounces of liquid to provide enough water to increase the size of the stool mass and stretch the intestinal wall, promoting peristalsis. Bulk laxatives should be taken when the client is most active. The therapeutic effect occurs within 2 to 3 days. Stool softeners are not contraindicated with bulk laxative use. 16. After obtaining a medication history from a client who informs the nurse of her early pregnancy, which of the following drugs is a priority for the nurse to obtain in order to discontinue? A. Misoprostol. B. Docuzit. C. Magnesium hydroxide. D. Bismuth subsalicylate. Answer. A. Misoprostol. Rationale. Although all drug use needs to be questioned in the first trimester of pregnancy, misoprostol, which may be used in peptic ulcer prevention as a prostaglandin and cytoprotective agent, is known to cause miscarriages. Docuzit is a mild surfactant laxative, which has no adverse effects. Magnesium hydroxide and bismuth subsalicylate are mild antacids with no teratogenic effects. 17. Which of the following antacids should the nurse question administering to the client with a gastric ulcer and congestive heart failure? A. Magaldrate. B. Calcium carbonate. C. Magnesium hydroxide. D. Sodium bicarbonate. Answer. D. Sodium bicarbonate. Rationale. Sodium bicarbonate has higher sodium levels than other antacids and is contraindicated for clients with ulcerative disease and heart failure. Magnesium-based and calcium-based antacids, such as magaldrate, calcium carbonate, and magnesium hydroxide, are often chosen for clients with heart failure because of their low sodium content. 18. The nurse is caring for a client who admits to a 15-year history of gastric ulcers. The nurse instructs this client to take which of the following drugs for minor aches and pains? A. Acetaminophen. B. Buffered aspirin. C. Plain aspirin. D. Ibuprofen. Answer. Acetaminophen rationale. Acetaminophen has no adverse effect on the gastric mucosa and produces no ulcerative effects when administered for pain. Buffered aspirin does not reduce the incidence of gastric ulcers, although enteric-coated aspirin dissolves in the intestine rather than the stomach. Plain aspirin is associated with development of gastric ulcers. Non-steroidal anti-inflammatory drugs, such as ibuprofen, may cause gastric ulceration. 19. The nurse should instruct which of the following clients that taking which antacid may result in constipation. A client taking A. Magaldrate. B. Magnesium and aluminum. C. Aluminum carbonate. D. Magnesium hydroxide. Answer. C. Aluminum carbonate. Rationale. Most antacids affect the bowel. Some promote constipation, such as aluminum carbonate, and others promote diarrhea, such as magnesium. Effects can be minimized by combining aluminum and magnesium. 20. A client is experiencing peptic ulcer disease caused by H. pylori. The nurse should plan to administer which of the following oral drug combinations? A. Clarithromycin with tetracycline with sodium bicarbonate. B. Metronidazole and aluminum hydroxide. C. Amoxicillin and omeprazole. D. Penicillin and nizatidine. Answer. C. Amoxicillin and omeprazole. Rationale. Clarithromycin is used in combination with amoxicillin and omeprazole as an effective combination to combat H. pylori. 21. The nurse should assess which of the following body systems while administering intravenous cimetidine to a client. A. Urinary. B. Immune. C. Respiratory. D. Cardiovascular. Answer. D. Cardiovascular. Rationale. Cimetidine is a histamine 2 receptor blocking drug used in the treatment of ulcers and gastroesophageal reflux disease. The cardiovascular system needs to be assessed. Intravenous cimetidine can cause dysrhythmias and hypotension. Other body systems that need to be assessed include the gastrointestinal, hematologic, metabolic, central nervous system, and genital systems. Tagamet does not affect the urinary, immune, or respiratory systems. 22. Which of the following is a priority for the nurse to administer to a client with gastroesophageal reflux disease? A. Cytoprotectors. B. Antibiotics. C. Proton pump inhibitors. D. Anticholinergics. Answer. C. Proton pump inhibitors. Rationale. Drugs used to promote healing the tissues damaged by acid reflux include antacids and anti-secretory drugs, such as proton pump inhibitors and histamine 2 receptor antagonists. Cytoprotective, antipeptics and antibiotics and are primarily used for peptic ulcer disease. Cholinergics are used on rare occasion for gastroesophageal reflux to increase the rate of gastric emptying. 23. Which of the following should the nurse include in the teaching plan the nurse is preparing for a client taking sucralfate? A. Sucralfate reduces gastric acid production. B. Administer sucralfate with breakfast. C. Separate administration of sucralfate with other drugs by 2 hours. D. Sucralfate works against H. pylori. Answer. C. Separate administration of sucralfate with other drugs by 2 hours. Rationale. The administration of sucralfate should be separated from other drug administration by 2 hours to protect those drugs from binding to the protective adhesive that forms. Sucralfate is an antipeptic, cytoprotective gastrointestinal drug used to protect eroded ulcer sites from further acidic damage. Sucralfate should be administered 1 hour before meals. Antibiotics are used in peptic ulcer disease to fight against H. pylori. 24. The nurse evaluates that medication teaching has been effective when the client states that ranitidine A. Decreases gastric acid levels. B. Changes hormonal levels. C. Increases pepsin levels. D. Decreases pH levels. Answer. A. Decreases gastric acid levels. Rationale. Ranitidine is a histamine 2 receptor antagonist, which suppresses gastric acid secretion. Changing hormonal levels is not a primary action of ranitidine. Cimetidine suppresses pepsin production. Zantac also reduces hydrogen ion concentration, which will increase pH levels. 25. The registered nurse is preparing to delegate assignments for the day. Which of the following assignments would be appropriate to delegate to a licensed practical nurse? A. Contact a client's physician when the blood pressure is lower than 100 mm Hg before administering a beta-2 adrenergic blocker. B. Monitor the heparin level daily before administering heparin. C. Question administration of streptokinase to a client admitted and suspected of an intracranial hemorrhage. D. Take the blood pressure before administering a dose of verapamil. Answer. D. Take the blood pressure before administering a dose of verapamil. Rationale: contacting a client's physician, monitoring the parin level, and questioning the administration of a drug are all nursing tasks that should be performed by a registered nurse. A licensed practical nurse may take a blood pressure before administering a drug. LPNs are trained to take the blood pressure. If the blood pressure is too low or too high, it becomes the responsibility of the registered nurse to notify the physician. 26. The nurse is caring for a client admitted with severe rectal bleeding who is receiving warfarin therapy. Which of the following interventions should have priority in the plan of care? A. Accurate intake and output. B. Discontinue the warfarin. C. Assure a patent 18-gauge IV. D. Administer vitamin K. Answer. C. Assure a patent 18-gauge IV. Rationale: although maintaining an accurate intake and output, discontinuing the Coumadin, and administering vitamin K may be anticipated, the priority intervention is to assure an 18-gauge IV needed for potential transfusion of blood if bleeding causes hypovolemia and low hemoglobin. 27. The nurse is developing a medication schedule for a client receiving simvastatin. To promote maximal effectiveness, the nurse should administer the drug A. 30 minutes before a meal. B. With meals. C. At bedtime. D. Early in the morning. Answer. C. At bedtime. Rationale: simvastatin is an antihyperlipidemic. Because cholesterol synthesis normally increases during the night, statins such as Zoca are most effective when given in the evening. 28. The nurse is caring for a client taking atorvastatin. The client admits to consuming 6 to 12 beers daily. The nurse should monitor the client for what potentially serious adverse reaction to Lipitor. A. Nephrotoxicity. B. Hypertension. C. Hepatotoxicity. D. Dyspepsia. Answer. C. Hepatotoxicity. Rationale: atorvastatin is an antihyperlipidemic and HMG-CoA reduction inhibitor. The risk for hepatotoxicity while using Lipitor is increased by excessive alcohol ingestion. 29. The nurse should monitor a client with an acute myocardial infarction who is receiving intravenous streptokinase for which of the following serious adverse reactions? A. Intracranial hemorrhage. B. Intractable nausea. C. Extension of myocardial damage. D. Pulmonary embolus. Answer. A. Intracranial hemorrhage. Rationale: streptokinase is a thrombolytic enzyme used in the treatment of deep vein thrombosis, arterial thrombosis, acute evolving myocardial infarction, and pulmonary embolism, and to clear an occluded arteriovenous and IV cannula. It is a priority that the client is monitored for an intracranial hemorrhage that could potentially lead to coma and death. 30. The nurse is instructing a client on clopidogrel bisulfate. Which of the following statements by the client indicates an understanding of the effect of this drug? A. I should ambulate slowly. B. I may experience hypotension. C. I should use caution taking other drugs that cause bleeding. D. I should take a stool softener while on this drug. Answer. C. I should use caution taking other drugs that cause bleeding. Rationale: clopidogrel bisulfate is an antiplatelet drug that inhibits platelet aggregation, diminishing the potential for clot formation. Caution should be used when taking other drugs that may increase bleeding. Plavix may cause the adverse reactions of hypertension and diarrhea. Thank you for watching.